What about the importance of biologics in spine surgery? You know, we plan for constructs now very, very nicely with robotics. The software in Mazor is incredible for planning your constructs. Navigation, pre-planning, alignment, inner bodies, screws, screw lengths, sizes. It's phenomenal. And you can go into the OR ready and able to put exactly that construct in place. But shouldn't we also be planning the bone graft? What about the graft? I mean, the hardware is so important. It provides temporary stabilization, alignment. It's critical. It augments the fusion, but it doesn't create the final solution. The final solution is biological fusion in alignment. So the bone graft provides the long-term biological fusion, and there's a race from the initial fixation to the long-term fusion. If the biologic product fails, the hardware is going to fail or break, and we all know that. So there is this race. And I think picking the correct biologic for the correct scenario is what's most important. And I think we should pay attention to the selection of biologics with a lot more intensity like we have with instrumentation, robotic pre-planning, navigation pre-planning. And so let's focus on that.